present some information about my country with focus in its public health system. My presentation will cover these following topics. First, a brief country overview. Second, a general description of our public health system with focus in primary health care, and finally some health outcomes. Brazil occupies most of the eastern part of South America continent, with more than over 3 million square miles, and a population about over 193 millions of inhabitants. The majority of the population live in urban areas, mainly on the coast, and it's important to remember that more than 60% of the land area of Brazil is covered by tropical forests. The population density is about 9 people per square miles, but we have a big challenge to ensure some public services like education and primary health care to the population in a territory so large. The climate is tropical, and Brazil is the only Portuguese-speaking nation on the Americas. The capital of Brazil is Brasilia. It's not Rio de Janeiro. And this city is located in the central region of the country, and UNESCO recognized Brasilia as a World Heritage because its beautiful modernist architecture. Brazilian people is also very proud about the natural diversity. We have more than 4 miles of beach and a beautiful tourist place. Brazilian people speak Portuguese because we are discovered by Portugal in the beginning of the 16th century, and we remain a colony of Portugal until 1822. Other fact that marked the Brazilian history was is the military dictatorship that ruled the country for more than 20 years, hard 20 years. In 1980, with a civil president elected by the National Congress, Brazil approved a new federal constitution, very advanced in social terms, including because the new constitution recognized health as a civil right and a duty of the state. Before 1980, only people that have formal jobs and pay the public social insurance was able to access the public health system. In 1989, Brazil had the first direct presidential election after 29 years. It represents, it means that we have a young Democrats. In 2002, Brazil elected Lula, Brazil's first working class president. And nowadays, Brazil has its first female president, Dilma Rousseff. In terms of economy, Brazil is classified as an upper middle income country by working. Brazil is the 6th largest economy in the world and one of the fastest growing economy, with a GDP over $12 trillion, more than average in Latin American developing countries and the average in upper middle income countries. However, in terms of social development, we have a lot of challenges. Despite Brazil is classified among countries with high social development, we have a lot of problems related with regional inequalities. In 2009, Brazil was classified with Gini index with about 55% of inequality. Gini index is a measure of the distribution of incomes. We use a scale from 0 to 100, where 0 represents the perfect equality, everybody with the same income, and 100, the worst inequality. As you can see in this scale, greater the strongest the green color, more greater the inequality. And then we can show that Brazil still has is among the countries with higher inequality. And this slide exemplifies social inequality in Brazil. Poor people face a lot of problems with public transportation, public transports, employment, and housing. On the other hand, São Paulo, the largest and richest city in the country, has a number. The number of private helicopters in São Paulo is the great, the largest in the world. And the luxury consumption market in Brazil has one of the fastest growing. We can see in the largest cities fancy buildings with one swimming pool per floor near large slums. However, this situation is changing. Nowadays, the slogan of the federal government is a rich country is a country without misery. And over the last 2 decades, we are achieving good results. In this graphic, the brown line represents the Gini coefficient, and the blue line represents the population below poverty line. With this trend, we will be able to achieve the Millennium Development Goal to poverty reduction before the scale. And it states some public policies like an efficient control of the inflation, it's very important, and some social programs like Bolsa Família and Saúde da Família. Bolsa Família could be translated as family fellowship. It's a federal program to transfer money to families with low income. And families to maintain this financial incentive, this financial transfer, need to maintain children at school and to go regularly to primary health care centers, to immunizations, to follow the growth and development of children, and pregnant women need to do the prenatal care. And it's very important, the family health program, to ensure access to primary health care and to follow these conditions. In Brazil, Brazil's health profiles is similar of other developing countries. In this slide, we can see the population pyramid in 2000 and 2010. This pyramid shows the distribution of population between gender and age. Each line represents one age group. And we can see in only 10 years the change on the shape of the pyramid. It is related with a phase of development. We have improvements in the life conditions and healthcare that cause and decrease in great fertility, great infant mortality, and an increase in life expectancy. Other aspect we call this kind of changes, social changes, as epidemiological transition. Another aspect of the technological transition is a decreasing trend in infectious diseases as cause of deaths, and while the current non-communicable diseases occupies a most important position in the rank of the main causes of deaths. But in developing countries, we have a phenomenon called the double burden of diseases, because we have a coexistence of infectious diseases and chronic non-communicable diseases. This coexistence of infectious diseases and non-communicable diseases in developing countries is caused for a lot of problems, but one of these problems is related with some diseases like AIDS and other diseases strongly related with AIDS, like tuberculosis. This graph shows the prevalence of HIV in the world. In Brazil, have a good program to control the problem of HIV, and we have a prevalence similar to the United States. The incidence of AIDS disease in 2010 was 9 cases per 100,000 inhabitants. And the main category of exposure is sexual transmission. The Brazilian public health system is called Unified Health System, and it is one of the most comprehensive health systems in the world. This public health system is guided by the following principles. Universality, it means that all the citizens can have free access to the public health system. Comprehensiveness, the public health system needs to ensure access to all levels of healthcare. Equity, the health system is needed to prioritize people with most needs. Community participation, each level of government, and including the health services, has committees with representatives of the population. Political and administrative decentralization. In Brazil, we have a unique federalism. We have 3 levels of government with autonomy. We have the federal government, 26 states, and 5,500, more than 5,500 municipalities. Each level with autonomy to decide how to organize the health system. But we have committees with representatives of the 3 levels to decide, to have agreements about the health policies. Regionalization, the majority of the municipalities has less than 20,000 inhabitants and don't have conditions to ensure access to all the levels of the health system in his territory. Then we need to have agreements to ensure access of high complex procedures in other cities. And finally, hierarchy. This triangle represents the hierarchy and comprehensiveness of the Brazilian public health system. Primary health care is the health basis, and primary health care should solve about 8% of the most common problems, health problems, offering immunization, health promotion, medical consultations, home care, dental care. The next level is specialized care, and the last level, high complex procedures, including transplants, dialysis, and cancer treatments. Nowadays, Brazil realized Brazil offered more than 9 million of mammograms per year, and Brazilian health system ensure treatment to AIDS, people with AIDS, and we have one of the largest public program of transplants. We produce more than 20,000 transplants per year, and nowadays we are including our public health system are including offering sexual change surgeries with a lot of criteria, but it's one of the services. But we have a lot of inequalities in our public health systems, a lot of challenges. We have a lot of services with international quality level, but we also have long queues for care. We have crowded hospitals and primary health care units in precarious conditions. It's important to recognize that despite the public health system in Brazil is universal, despite the name of our public health system is Unified Health System, we have two health systems, because 25% of the population has private health insurance. But more than half of the people with private health insurance also use the public health system. Only 9% of the population don't use the public health system. And about the health financing, in this slide we can compare Brazil with upper middle income countries in the United States. In 2010, Brazil spent only 9% of the GDP with health. It is higher than similar countries, but is very low than in the United States. And the healthcare expenditure in Brazil is less than $1,000 per year. It is higher than similar countries, but it is over 8 times lower than in the United States. The public health expenditure in Brazil is lower than in similar countries in the United States. And the out-of-pocket of health expenditure is higher in Brazil, mainly because the payment of medicines. 60% of the out-of-pocket expenditure in Brazil is related with medicines. But the problem related with the underfunded public health system in Brazil is changing. The budget of the Ministry of Health is increasing, and in 2012 we have more than 14% of increase in the budget of Ministry of Health. And we are investing more money in improve the access to medicines. Besides the public network of pharmacies, we are improving the generic drugs with cheaper prices, and Brazil creates the popular pharmacy programs, accrediting private drugstores to ensure free access to some medicines, and a program to improve the quality of pharmaceutical care. One of the most important initiatives of the Brazilian public health system is the increasing coverage of primary health care through family health program. In less than 15 years, Brazil doubled the coverage of primary health care in community health workers. These programs are very important because they prioritize the poorest communities. This graph shows that the smaller the household income per capita, the greater the proportion of family health program coverage. And what is family health program? Family health program is, let's say, we can describe as family health teams with physician, nurse, nursing assistant, 4 to 6 community health workers, dentists, and dental assistant. Nowadays, Brazil has over 33,000 family health teams, and more than over 70% with oral health professionals. Each family health team are responsible for about 3,000 people. And the performance of these teams need to cover all the dimensions of primary health care. Health promotion, prevention, recovery of health, and home care. And it's important to recognize the role of the community health workers in our public health system. Because they represent a link between the communities and the health system. The health system with the community health workers don't need to wait that people get sick to look for the public health service. We have nowadays a 250,000 of community health workers, about 4 to 6 per team. These community health workers are selected on the communities. They live in the communities where they work, and they are trained and supervised by health professionals. Each community health worker is responsible for about 750 people, and they develop activities related with health promotion and prevention of diseases. It's important to recognize that the family health program, the community health workers don't work only in the primary health care units. They work in schools, they work in households, and they work in the streets. Nowadays, Brazil has a big problem with the increasing users of drugs like crack, and it is increasing the number of homeless people. And the family health program support programs like public health clubs. Brazil is implementing more than 4,000 public health clubs to motivate people to have more physical exercises and healthy habits. And we have a lot of programs nowadays to improve the quality of family health program. We already achieved a larger coverage, and now our most important challenge is related with the quality. We are trying to improve the equity in the distribution of primary health care federal funds. We are giving more money to the most poor communities. We have the national plan for improve the primary health care units, construction, renovation, and equipments. And we are including building boats to ensure access to primary health care for the little communities that live along the rivers, in the most isolated areas. And finally, the enhancement of healthcare professional. This program tried to motivate physicians, nurses, and dentists recently graduated to work for a year or two in more isolated areas, in the periphery of large cities, like slums. And we offer a lot of incentives to attract and provide health professionals for these communities. important initiative is the National Program for Improving Quality of Primary Health Care. This program is based in monitoring and evaluation of primary health teams, linking the outcomes with financial incentive proportional to the performance of primary health care teams. And besides this financial incentive, the Ministry of Health offers a lot of technical supports for improving quality. And despite this program, although this program is optional, the participation is optional, more than 7,000 teams participate in the first year of implementation. This will be 2012 is the first year of implementation. Other important challenge that our public health system are facing is related with the chronic non-communicable diseases. We are trying to improve the access to medicines to control asthma, diabetes, hypertension, but we also are investing in actions related to decrease the risk, the risk factors related with these chronic non-communicable diseases. Recently, we have an important agreement between the Ministry of Health and the national food industry to reduce sodium content in processed foods. The goal of this project is to control an important risk factor related with diseases like hypertension. About some outcomes that we achieved, I would like to highlight the outcomes related with the control of AIDS in Brazil. The incidence of AIDS decreased in about 38% in all and we have decrease in all the categories of exposure. Other important outcomes are the decrease in smoking prevalence, the reduction of mortality rate due to chronic non-communicable diseases, and the reduction of hospitalizations for sensitive conditions to primary health care. It means that when primary health care is working well, we can avoid hospitalizations, we can prevent hospitalizations, suffering, and we can save money for the families and for the public health system. And we also decreased the child undernutrition. In 10 years, Brazil decreased in 50% the child undernutrition, including due to expansion of family health program. But the most important outcome is related with the reduction in infant mortality. Brazil already achieved the Millennium Development Goal related to the infant mortality reduction. And nowadays, the infant mortality rate in Brazil is lower than in Latin America, developing countries, and upper middle income countries. And there are a lot of studies proving proving the role of family health program in the reduction of infant mortality. This graph shows that every 10% of increase in coverage of family health program was able to reduce in more than 4% the infant mortality, more than the effects of water supply and hospital beds. And besides the effects, the direct effects in health, we have studies that show that 8 years for exposure to the family health program are associated with increase in the labor supply of adults, reduction in fertility, increase increase in children's school enrollment. This kind of outcome was already found in other countries. And after more than 15 years, we are also finding this social effect in Brazil. To finish my presentation, I would like to highlight some messages. First, Brazil is not a poor country, but unfortunately Brazil still has a lot of social inequalities. However, these inequalities are decreasing thanks to some public policies, including the increasing coverage of primary health care. And Brazilian health system is one of the most comprehensive. The Brazilian health system is one of the most comprehensive in the world. And besides, despite the insufficient public health expenditure, we have important outcomes. Then this is my message. I